AngieTraining. Transform sleep. Transform lives. Welcoming a newborn into your life is a transformative experience, filled with immense joy, anxiety, and a seemingly endless stream of questions. Whether you are a first-time parent in Amman, a caregiver in Los Angeles, or a new mother in Manila, the foundations of newborn care share universal themes: nurturing with love, responding to your baby's unique needs, and learning each day. Preparation is not just about the physical space, but about creating a sense of calm for you and baby. If you notice you're anxious, talk it out with a partner or trusted elder. Safe and clean environments, even with basic resources, are more important than having fancy equipment or an elaborate nursery. Step 1. Ensure baby's sleep space is clean, smoke-free, flat, and away from hazards. Step 2. Maintain a comfortable room temperature, ideally 20 to 22 degrees Celsius, 68 to 72 degrees Fahrenheit, using a room thermometer. Avoid overheating. Step 3. Place the baby's crib or sleeping surface close to where you sleep, but not in the same bed, supported by SIDS prevention guidelines. Step 4. Avoid soft bedding, heavy blankets, and stuffed toys in the sleep area. Use a fitted sheet only. Step 5. Wash and disinfect hands before touching the newborn, particularly after changing diapers or before feeding or handling the umbilical cord. Across all reputable international guidelines, including WHO and UNICEF, several interventions are prioritized in the minutes to hours after birth. Drying the newborn thoroughly within seconds to prevent heat loss. Promoting skin-to-skin contact to regulate temperature and bonding. Encouraging the first breastfeed within 1 hour. Delayed umbilical cord clamping. Wait at least 1 to 3 minutes unless medical need. Administering vitamin K, hepatitis B, and, where indicated, BCG vaccines. Explaining why sun exposure during the first day is not advised, contrary to some older beliefs. Culturally, elders may urge traditional remedies or premature bathing. It is okay to explain, "The doctor wants us to keep baby warm and wait 24 hours before washing. Can you help us keep him wrapped and watch him together?" Immediate warmth, bonding, and breastfeeding are medically proven across all cultures. Elders' involvement in comforting, not conflicting, is ideal. The overwhelming consensus in both international and local health guidelines is that exclusive breastfeeding, no water, no formula, is best for newborns for the first 6 months when possible. Still, how you approach feeding must be responsive to both baby and mother. Find a comfortable, quiet spot, sitting upright or slightly reclined. Hold your baby tummy to tummy with you. Support your breast with your hand, finger away from the areola. Wait for your baby to open their mouth wide, rooting cue. Bring baby to breast, not breast to baby. Chin touches breast first. Listen for regular swallowing, small caw or swallowing sounds. Feed for 10 to 20 minutes per side. Switch sides if baby releases or becomes sleepy. Wash hands and bottle thoroughly. Use boiled/tap water cooled to room temperature. Measure formula exactly. Avoid over or under concentrated mix. Hold baby upright, supporting head, and never prop the bottle. Discard any remaining formula after feed. If breastfeeding is painful, seek support before quitting. Responsive caregiving means tuning into baby's cues for both hunger and comfort, not the clock. Formula is a safe alternative when breastfeeding is not possible, but should be prepared hygienically and with loving attention. Feeding is not just nutrition, it's communication and bonding. Watch your baby, not the clock, not rigid schedules. Ask for help if you feel uncertain or frustrated. Crying is every newborn's primary way of communicating needs. For hunger, a wet diaper, overstimulation, temperature discomfort, or simply the need for connection. Studies and regional parent handbooks show that all babies cry, sometimes for hours each day, especially in the evenings, colic. Watch this scenario and select a response, then compare the outcome with your selection after reviewing soothing strategies at the end of this section. First, check for hunger. Offer breast or bottle if more than an hour since last feed. Check diaper. Clean and dry if wet or soiled. Assess temperature. Touch baby's back or chest. Hands and feet often feel cool, but the body should be warm. Swaddle gently. Arms at sides, hips loose. Rock slowly, sing softly, or make shush sounds. Use white noise if available. Offer a clean finger or pacifier to suck if baby is comforted by sucking. Watch this scenario and select a response. Compare the outcome with your selection. Look for baby cues closely. Once you've learned to recognize your baby's signals, like fussiness, crying, or rooting, responding early to hunger signs can prevent crying and make feeding more comforting for both baby and caregiver. Stay calm. Your own anxiety can heighten your baby's distress. If you feel overwhelmed, it's okay to put your baby down in a safe place and take a few breaths or call for help. It's impossible to spoil a newborn with attention. Babies need prompt, kind responses, especially during crying spells.